Pregnancy. Some may call it the most incredible experience of their lives, or exhilarating as my wife calls it, while others can't think of a more challenging time. However, one thing is for sure, and that is after personally witnessing this 3 times myself, I can confidently say that it is an ever-evolving journey resulting in the greatest miracle. Just consider this. In only a span of 9 months, a woman's body has the innate intelligence to grow another human body, adapting to all changes needed to bring to life a miracle into this world. Let me explain. Once conception occurs, a part of the brain called the corpus luteum secretes the hormone relaxin, rising considerably between the 10th and 12th week before it steadies off. This allows for the unthinkable to occur. The spine and pelvis begin to change shape as the demand for space in the belly grows. Now that's incredible. The body grows and adapts to the size of the growing baby. Postural changes involuntarily become the new norm before another stretch of growth. The female human body basically continues to evolve every day throughout this 9-month journey. However, all of these changes for many mothers-to-be come with a host of discomforts. For example, the changes in the body constrain the upper back. They constrain the jaw and neck, contributing to neck pain and headaches. If morning sickness is experienced, which is pretty common in the first trimester, a tight diaphragm only contributes to more tightness to the mid-back. As the belly grows, the changing shape of the lower back curvature, coupled with a potential pelvic misalignment, can create an increased strain around the pelvis, which could result in lower back pain and nerve pain down the back of the legs. Some just see these changes as pain drivers, but as a health practitioner, I look at this a little deeper and see how this could potentially affect the delivery process. It is reported that 50 to 85% of expecting mums experience lower back pain, and many carrying it postpartum. These numbers just paint how challenging this time could be for the expecting mum. This is where a proactive approach is needed to address the mental, emotional, and physical needs during the journey. Chiropractic care for pregnancy is a wonderful, comfortable, and natural way of supporting the body throughout all the stages of pregnancy, as well as to treat the discomforts and pains that arise due to this constantly changing neuromusculoskeletal system. In simple words, we look at relieving discomforts caused by strains on the spine and pelvis, as well as create better structural alignment and pelvic balance for a desirable birthing outcome. During the first visit, we take a detailed history, discussing your symptoms and general contributing health and lifestyle factors. We then run through specialized postural, orthopedic, and neurological examinations to provide clinical clues into what state your body is in whilst carrying bub. We also discuss any potential complications caused by placenta positioning, baby positioning, multiple child carrying, such as twins, as well as pre-existing health conditions. Naturally, we take into account the stage of pregnancy you are in and make the consultation as comfortable as possible for you and your baby. We discuss your delivery goals and formulate a path that will help achieve these goals, whether they are just to be relieved of pain, or perhaps you'd like to be working on correcting and strengthening any of those neuromusculoskeletal concerns. It is shortly after this where we deliver our first adjustment, which is performed on a specialized table and pregnancy cushion, making the treatment comfortable for you and bub. Using a range of adjusting techniques, we work on correcting alignment and relieving that tension that's built up in the joints and the frame. Specific and relevant exercises are prescribed where necessary, with recommendations given at each stage of either supportive aids or lifestyle modifications. So let's go back to the adjustment. All adjustments are performed with baby in mind. It is vital for your baby to be comfortable, for you to be comfortable, and this is why adjustments are tailored specific to each pregnant lady. The adjustment is delivered as a low force movement, which not only influences the joint being adjusted, but also the neurology around it. Think of it like pain relief through movement of the joint and hence activation of the nerves and supportive tissues. Our adjustments over time change, especially when moving into the 3rd trimester, where we begin to introduce the Webster's technique. The Webster's technique is a specific chiropractic sacral analysis and adjustment. The goal of the adjustment is to reduce the effects of sacral and sacroiliac joint dysfunction, which is in the lower back. In doing so, neurobiomechanical function in the pelvis is facilitated. Once again, our focus moves from getting our pregnant mum out of discomfort and into optimal uterine position for delivery. As a chiropractor and father of 3 children, I am passionate about assisting mothers-to-be or second, third-time mums through every stage of this miraculous journey and beyond. I have been adjusting pregnant ladies for over 15 years, and having adjusted my wife through 3 deliveries, I understand the challenges mums face even beyond delivery. Through chiropractic treatments, I have helped relieve symptoms of neck pain, headaches, shortness of breath, reflux, jaw tightness, mid-back pain, lower back pain, disc flare-ups, sciatica, pelvic misalignment, scoliosis, pubic symphysitis, and the list goes on. I am committed to helping mums achieve their health and delivery goals.